everyone, and good morning. Today is Monday, November 8th, and joining me today and every Monday is Dr. Timothy Bray, UTD EPPS professor and director for the Institute of Urban Policy Research. Today, Dr. Bray will give us our North Texas 7-day COVID-19 trend update every week that he does that. And then today, we'll also see him give us some data on last week's state election. Dr. Bray, it's all you.
Good morning, Dani, and thanks again for having me. So as you can see, we continue to have good news on the COVID front here in North Texas. Our new cases are down under 10,000 from over the last 7 days. So the last 7 days, we've had 7,300 new cases. This is down almost 25%. We're down 22% from the previous week. Deaths are down as well, under 200, with down about 15% in the last week. And active cases, the number of people currently battling the coronavirus disease, is under 20,000 in North Texas, 19,039, down 18.25%. We continue to see good news on the hospital front. Our capacities are decreasing. This is our overall capacity. 88.6% of staffed and available hospital beds are full. 90.8% of staffed and available ICU beds are full. But what we are seeing is COVID hospitalizations going down and more people who are sick with other conditions being able to use those beds. So while our occupancy hasn't dropped that much, we are starting to see a bigger variety of patients being able to take advantage of the quality healthcare that we have here in North Texas. Vaccination update, we are at 71%. At least partially vaccinated, 74% of the state of Texas at least partially vaccinated. So we're making headway, but we do have a significant amount to go. Those data, by the way, do not yet reflect changes in recent rules that allow children age 5 to 11 to be vaccinated. So their numbers aren't in there yet. Anecdotally, I was at an event this weekend and was talking to a mom who has already had her daughter vaccinated as soon as it became available. And again, this makes sense for people to talk about with their pediatrician, with their physician, about what the best course is for their child.
Thank you so much, Dr. Bray, for that COVID-19 update. Now let's turn it over for our social statistic data this week. We're going to talk about voter turnout for the Texas state election. I'll throw it over to you.
Great. Well, Dani, as you know, last week we had a constitutional amendment election, in addition to a number of local elections, city council races, school district races, and a number of important bond and city proposition issues. One of the patterns that we saw last week, which continues a sort of cautious pattern we need to pay attention to, is voter turnout. It's not unusual for turnout in off-year elections to be down. These are elections that don't feature highly contested presidential races or even gubernatorial races. But in Texas, only 8.7% of registered voters and 9.2% of active voters showed up for the election. This is just under 1.5 million out of 17 million. It's about 6% of the state's total population. And these were fairly wide-reaching constitutional amendments. One of the more prominent one in the wake of COVID, we had two to talk about, Proposition 3 and Proposition 6. Proposition 3 would make it unconstitutional for the government to come in and regulate religious meetings. In other words, the government could not regulate how many people could attend a church service, for instance, which was a big contentious issue in the height of the COVID pandemic. Proposition 6 would allow residents of who are what we would say need assisted living services. Often these folks have some sort of mobility impairment or cognitive impairment. They live in an assisted living facility or a nursing home. It would allow these folks to designate someone to be a caregiver who would always have access to them. This was one of our big challenges. Again, you may recall in COVID, family members who were completely cut off from the rest of their family and their support system. So again, two fairly large, far-reaching constitutional amendments. Additional amendments included looking at who could be eligible for the Supreme Court of Texas, how the court deals with judicial conduct, how counties are allowed to spend money on redevelopment, and then a couple property tax reforms. For instance, the surviving spouse of a disabled of someone who is receiving a disabled exemption on their property tax, being able to keep that exemption after their disabled partner passed away. So significant impacts statewide, which again, only about 6% of the population, 8% of voters turned out to decide. Contrast that with the 2020 presidential election. We had 65%, almost 2/3 of registered voters and almost 3/4 of active voters. More than 11 million turned out for that election. And in 2018, a slightly less slightly less advertised, if you will, not a national election, but we had we had a Senate election, and we had our state executive officer, the governor, 53% of registered voters and 60% of active voters. So our real challenge here is getting more and more people engaged in the electoral process, because these decisions matter. At the local level, we saw several school district elections where $1 million bonds were decided by 3, 4, 5,000 voters, a very small percentage of the registered voters in the school district. This sets up a situation where people tend to disconnect from the electoral process, and that's unhealthy for any democracy.
Yeah, thank you, Dr. Bray. And I want to point out, too, although our presidential election is extremely important in our country, local elections are almost more important for that direct correlation of voting for something that is going to directly affect you and how quickly it will affect you. So real quick, what do you think we can do to get the voter turnout higher in local elections?
Yeah, that's a great question, Danny. I had a political group once ask me, how can we improve turnout? And I suggested they need to spin the model. Right now, the big argument from all of the voter engagement folks, or I should say the campaigns, is about mobilizing the vote on election day. But we need to do more than just get people to go vote. We need people to hold their elected officers accountable. We need people paying attention to city council meetings and county commissioners' courts meetings. We need folks to know what's being voted on and how it's being decided. Texas is a great example, by the way, of a very complicated and difficult to understand school finance system. And quite often, voters are either enraged or upset about something a district has decided to do and how they propose to fund it. And they want them to change how they spend their money. But school districts in Texas are quite often hampered about how they can spend that money. The more difficult it is for voters to understand the process of government at work, the more likely they are to be disconnected from it. So really, it's both an education and a mobilization campaign that we need.
Well, thank you so much, Dr. Bray, both for the COVID-19 updates and the voter turnout statistics. Join us next week when we will give you some more COVID trend data updates, as well as a new social statistic. Thank you so much, Dr. Bray.
Thank you, Danny.